Do not be fooled by the cute name of this bug. Ugo volunteered for Global Housing Inc., a charitable organization that sends volunteers to underdeveloped countries to build housing. One summer, he was stationed at a remote South American location. His sleeping accommodations consisted of a dorm made of wood and mud-faced walls. Harriet, a kissing bug, emerged from the thatched roof of the dwelling and hovered over sleeping volunteers. Lots of choices here, especially if they snore, Harriet said. She was attracted to exhaled carbon dioxide. Here is a good spot. The boy felt Harriet land near his lip and instinctively slapped his cheek. His hand barely missed, striking Harriet as she quickly flew away. The boy returned to snoring. Oh gosh, that was close. I'll have to be more careful. Harriet hovered and found Ugo as her next target. This time, I'll be aiming near his eye. He has long nails and probably won't hit himself there. Harriet gently landed. A little bit of lube and we'll be ready to go. Harriet spit out saliva, which contains an anticoagulant to prevent blood clotting. She lowered her head and directed her sharp, lancet-like needle into Ugo's skin. Easy does it. He won't feel a thing. Slowly, Ugo's blood was filling Harriet's body. Soon, her body was engorged with his blood. Harriet's attack of Ugo produced an itch, causing him to scratch with his fingertips, thus pushing contaminated feces into his blood at the bite side. Harriet's last meal was from a squirrel who was infected with the Trypanosoma cruzi parasite. Ugo was now unknowingly infected. Soon, the parasite multiplied within Ugo's blood. He never developed symptoms and never learned of his infection. He had some unconcerning inflammation around his left eye. The swelling resolved and soon he was home in Texas. Later that month, a police officer was wounded and needed a blood transfusion. Knowing he was a universal donor type O, Ugo donated. His unit was not needed, so his plasma was stored in a bank for future use. Ugo's blood was eventually given to a neonate undergoing cardiac surgery. Unknown to the doctors, the plasma that the infant received was infected with T. cruzi. While the operation was successful in repairing the heart defect, the baby acquired Chagas disease and died a few weeks later. The child's immature immune system made him vulnerable. Ugo never knew that his blood caused the death of a child. The kissing bug is so named because it bites mucous membranes of the lips and around the eyes. Sometimes an infection occurs when feces accidentally drop into the mouth of a sleeping victim. For most people, symptoms such as swelling and fever resolve spontaneously with no long-term problems. For others who have a weakened immune system, the infection can damage the heart and the gastrointestinal tract. Heart failure is a leading cause of death of Chagas disease. About 10 million people are infected with T. cruzi. While the majority are in Latin America, transmission of the parasite has occurred in the US through contaminated blood supply, causing Chagas disease, which is treatable if detected early. Currently, blood banks in the US are not testing for this parasite because of the cost and the low incidence of infected units. Stay tuned for more lab tales.